The main symptoms are going to be shortness of breath, heart palpitations, which just means that your heart fluttered, like you notice it. You should never notice your heart. That's a heart palpitation. Rapid heart rate for no reason. Recently, I had a patient reach out to me because she was concerned that spike protein might affect her baby. Now, her and her husband are both healthcare professionals, but we have a lot of questions. Everybody has a lot of questions. Not everybody knows what's going on. So today we're going to talk about spike protein. First of all, what is spike protein? Well, spike protein, if you remember the virus called SARS-CoV-2, which looks like this picture here, the spikes are what are surrounding it. It's these spikes that you can see that are on the outside of the virus that typically attach to a surface of a tissue so that the virus can then infect the tissue. That's at least normally what goes on there. The spikes are typically benign. However, in SARS-CoV-2, the virus is benign and the spikes are actually causing all the damage. Now, I'm aware that some people think virology itself is a hoax and that viruses don't exist. For me, I don't know. I've never seen a virus. When I treat patients, I'm paying attention to the presenting signs and symptoms, and I treat the physiology. So I don't need to know whether or not they have a particular virus or what type of infection. I'm looking for signs of an immunological event, or what I found with COVID is that I had much more of a blood flow event. I knew that before we were told that it's the spike protein causing it. But nonetheless, if you've seen my 5 stages video, you know that the spike protein is more damaging than the virus and that it's more of a blood flow dilemma than it is an immune system problem. Now, the challenge here is that spike protein can be produced within the body by either getting SARS-CoV-2 infection or by getting the vaccines that make your body make spike protein. If you didn't know it, the mRNA vaccines make your body make spike protein. Some people don't know that. That is not controversial. That's a fact. Now, I understand in the research, they were trying to get that production of mRNA-produced spike proteins to be in a safe pathway within the body so that the person who's vaccinated was going to get the benefits of an immune response without the damage of the spike protein. However, we've seen that the results have been quite disastrous. A lot of people who have received the vaccines, the spike protein is escaping that protected pathway. And so what are we seeing are lots of reports of cardiovascular events, heart disease, etc. So now that can also happen from the infection side of it. So on both sides, you kind of have a mess, which is why sometimes I call it the COVID era, because either way, vaccinated or not, we're getting exposed to spike protein. Now, the reason why they were concerned is because if people come over to see the baby and they have been freshly vaccinated, they're not going to be transmitting the infection, but could they be producing the spike protein internally, and can it come out and get onto others? In that case, it's not an infection. There's no pathogen. It would be somewhat of a poisoning. It would be, something that's now being called shedding. So this is a controversial topic. Is it even happening at all? From what I've observed and our team for the last 3+ years is that it appears to be a real phenomenon. It actually is happening. We've just had so many people who their spouse had to get vaccinated for work, and then the moment they get vaccinated, they're having irregular menstruation and heart palpitations and purple tongue and all the blood damage symptoms that I described in the 5 stages video. And then they heal from that. We get them better. We work with them. The spouse has to get vaccinated, a booster for work, and then they get all the same symptoms over and over again. So we can see that that is a correlation. Even if we can't prove causation, we'll add to that so many people telling us versions of this. I even had an eye doctor reach out to me saying that their patients noticed that with the blurry vision, because as we know, those spikes can interrupt blood flow and the eyes are a single artery system. So they're very sensitive to this. And they were noticing the same correlation and wanted me to verify what I've seen. And so this is happening. Also, what we saw was this one point in time in 2021 when the vaccines were initially introduced into the population as a huge push. And what we saw at that time were massive amounts of Facebook groups and people reporting on social media all of these irregular blood flow patterns, including miscarriages and irregular menstruation for the women, all these blood flow patterns that also are what I've described in that stage 2 of the 5 stages, the blood damage. But everybody was reporting it suddenly after getting vaccinated. And it was a huge spike of discussion. It was controversial. It was, of course, suppressed, people describing just what they're going through. But then what happened is the vaccine schedules and boosters became staggered. So it was a one point in time where we saw a lot of people on the same page with the vaccine introduction schedule. I truly believe that the vaccine, very typical to so many medications that are introduced, the vaccines parallel many of the problems of SARS-CoV-2 infections, and that becomes a lucrative second market for the drug companies to capitalize on. So many drugs we see, the treatment has side effects that are described as the natural progression of the illness that's being treated, but it's actually not. It's caused by the drug, which then progresses to other drugs needed. Over and over and over again, we see this hoax and this scam in conventional care. Nonetheless, what are we left with is the concept of shedding. So shedding is that the person is producing spike protein. This can happen from the freshly vaccinated person. I also believe this can happen from the freshly infected person, and it's coming out of you and the person vaccinated, and it's going to get on to others. From what I've observed, I have a guess. This is purely a guess from having observed this and hearing from patients and from what I've seen, plus information from colleagues and peers, is that it would appear that the production cycle of spike within a vaccinated person is somewhere between 4 to 6 weeks, right? I have no way to support that, but just from what we've seen, that's what it looks like. We don't know the amount of spike protein produced. We don't know the length of time or if it happens in cycles, right? With the infected person, they are also producing spike. The amount seems to be lower and more localized to the damage of the person. However, it does shed as well from what we've seen, but the shedding cycle is about a week, week and a half, something along those lines from what we've seen. Now, my big concern is that on both sides, vaccinated and unvaccinated, that the person might produce more spike protein at a later date without getting another infection or without getting another booster. This is what I've observed. So somebody comes in with those stage 2 blood damage symptoms, we get them better, and then their tongue goes from purple to pink and all their symptoms improve. And so we dismiss them, discharge them, they're on their own without care from us. And a few months later, those blood damage symptoms come back and they didn't get another infection, right? So did they get shed on, which is a possibility, or are they producing it internally? Like as if we never get rid of the infection, like herpes or something. You just keep getting cycles of synthesis of the spike protein that damage you and make you feel like you're anxious and short of breath and all the symptoms that I've described in prior videos. So the thought of this couple is that a visiting relative, if they're freshly vaccinated, could that get onto the baby? We are not seeing any stories of infants or babies struggling from heart disease. We're not seeing that, but absolutely that could be the case. And it might just be subclinical, meaning that it's so minor that it's not noticeable. It's not needing to be treated, but it doesn't mean that it's not damaging or may have long-term consequences. So I think it's a very realistic concern for this couple. I do think it's a legit concern. So what do? Well, maybe you ask whoever's going to come visit, have you had a infection within the last few weeks, or have you had an injection within the last 6 weeks or so? Furthermore, because it could reoccur in cycles, that's a possibility, not sure, but it's a theory of mine. You could just simply ask, are you having any of the following signs and symptoms? Because these are the signs and symptoms that they're having a blood flow event that could be related to spike protein. The main symptoms are going to be shortness of breath, heart palpitations, which just means that your heart fluttered, like you notice it. You should never notice your heart. That's a heart palpitation. Rapid heart rate for no reason. Those are the main ones. So maybe just leave it at that even. But if we go a little bit further, of course, it would be fatigue, brain fog, blurry vision, tinnitus, pulsatile tinnitus, hair loss. These are anxiety, because whenever you affect the blood flow, you're going to get anxiety, chest pressure. Any of those symptoms are big risk factors given the last 3 years that there could be a spike protein involved, even though those symptoms also overlap with some other issues like thyroid issues can even cause some of those symptoms. But nonetheless, I hope this is useful to think through, and I hope you now know what the spike protein is, at least in theory, because I've never seen a spike protein. I definitely see the results of the unseen dilemma or phenomena on people, and I've treated it successfully because we're working with blood flow and vessel inflammation. But it's good to know, it's good to discuss, and we look for and share valuable information as we go forward. Take care.